Good morning or good afternoon to everyone, depending on where you are joining us from. Welcome to today's online event presented by the National Newcomer Navigation Network, a pan-Canadian network that provides opportunities for professionals from the health and settlement sectors to connect, learn, and collaborate. N4, which is funded by Immigration, Refugee, and Citizenship Canada and is hosted by CHEO. Before we begin today's webinar, I'd like to begin with an acknowledgement that N4 recognizes and values the continued connections and our ongoing relationships with our Indigenous peoples in Canada. They're traditional stewards of this great land, which has become the home to a diverse population of other peoples. N4 is hosted at CHEO, which is housed on the traditional and unceded territory of the Algonquin Nation, and for that, we are thankful. My name is Mariah Maddock, and I am a project coordinator with the N4 team. I will be hosting today's webinar. My co-host, Lauren Provo, will be monitoring the question and answer box today. And I'm very pleased to introduce you to our speakers today, who will be telling the story of an innovative and creative community partnership, the story of the Fredericton Downtown Community Health Center. And I'll just ask each of our speakers to turn on your camera or give a wave as I introduce you. So our first speaker today is Dr. Kelly Scott Story. Kelly is a health researcher and associate professor in the Faculty of Nursing at the University of New Brunswick, and the Director of Community Research, Scholarship, and Teaching at the Fredericton Downtown Community Health Center. Her research lies broadly in the intersection of violence, gender, and health, as well as social inequities. She holds over $4.5 million in research funding and is currently the principal investigator on 2 large multi-provincial randomized controlled trials, 1 CIHR operating grant and 2 NBFHRF bridging grants. Within her role at the Fredericton Downtown Community Health Center, she is part of a team working with community partners to prioritize newcomer, refugee, and immigrant health and wellness using low barrier and innovative approaches. And our next speaker is Dr. Tracy Rickards. Dr. Rickards is an associate professor with the Faculty of Nursing at the University of New Brunswick and the UNB nurse manager at the Fredericton Downtown Community Health Center. Completing her PhD at Dalhousie University's School of Nursing, Tracy's educational career includes a Bachelor of Nursing in 1986 and Masters of Nursing in 2005 from UNB. Dr. Richards was awarded a CIHR Embedded Clinician Researcher Salary Award, releasing her from 50% of her teaching responsibilities in order to engage in transformative health research at the Fredericton Downtown Community Health Center. Her research focus is on improving health outcomes for vulnerable populations. And our next speaker is Joan Kingston. Joan is and has been an effective advocate for stronger healthcare in New Brunswick. Her community engagement, policy development, and government expertise are great assets to all organizations she collaborates with. She received a Bachelor of Nursing degree from the University of New Brunswick and passionately loved her early work as a nurse in the neonatal intensive care and maternal and child health. She is a former president of the Nurses Association of New Brunswick and former chairperson of the New Brunswick Advisory Council on the Status of Women. Ms. Kingston was elected to the Legislative Assembly of New Brunswick in 1995 and held the portfolios of Minister of Environment, Minister of Labor, Minister responsible for the Human Rights Commission, and the Minister's Committee on Multiculturalism. In 2014, she led the establishment of the Fredericton Downtown Community Health Center, a partnership between the University of New Brunswick and Horizon Health Network. And next, we have Emily Kitts. Emily is a registered respiratory therapist and the facility manager at the Fredericton Downtown Community Health Center. Emily completed a Bachelor of Science from UNB in 2005 and completed a diploma in respiratory therapy from New Brunswick Community College in 2008. Emily is passionate about social justice and equity-oriented healthcare. Just want to give a very warm welcome to all of our speakers this afternoon. Thank you very much for joining us. And today's session is being recorded and will be uploaded to our N4 platform within 24 to 48 hours following today's presentation. Should there be any technical issues that arise during this webinar, all attendees will be informed with details on an alternate makeup session. Before we begin today's webinar, I'd like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions to the panelists in the Q&A window. If you would like to direct your question to a specific speaker, please include their name at the start of your question. We will be monitoring these questions throughout the session, and we know that sometimes many of you might have the same question or be interested in a particular response. Today, you have the option of upvoting a question. If you see a question in the Q&A box and are particularly interested in the response, please upvote it so we can prioritize which questions we pose to our speakers first. And with that said, I'm going to hand it over to our speakers today.
Perfect. Thank you, Mariah. And thank you to everyone online today for joining us. We're very excited to be presenting today. So the first thing I would like to say is that we are declaring no conflicts of interest. And with that, I'm going to turn the presentation over to Joan Kingston to start.
Sorry about that. I'd like to point out that today we have a participant online of the webinar who, her name is Liliana Calaba, and she is with the Multicultural Association of Fredericton. She's involved in settlement, and they are our community partners that are very important in terms of this particular presentation. And so I just wanted to give a shout out to Liliana because it's great working with her and with all of the Multicultural Association of Fredericton. We would also like to recognize and respectfully acknowledge that UNB campus and the Fredericton Downtown Community Health Center are on the unceded and unsurrendered lands of the Wolastoqey, and we're grateful for that. So anyway, in front of you, you'll see our team, and it's our big integrated team that belongs to both UNB and Horizon Health Network. We have a large team that my other colleagues will be talking about later on. But just to say that we are a teaching facility and we integrate both service and care as well as teaching and community-based research. And so it's a very important partnership between UNB and Horizon Health that we both benefit from. But in fact, without our community partners like Multicultural Association of Fredericton, we wouldn't be able to successfully serve the populations that we do. Next slide. Next slide.
I'll just insert Mariah. The option to advance slide is not on my screen.
Thank you. So in front of you, you see a very historic building actually in Fredericton. And it was our first home. We started out, and I use the royal we because I was involved in government at the time, actually in the Premier's office. Well, actually, no, anyway, that's a long story. So I was involved in government at the time that this was established, but in the beginning, it was established because of a grant that was available through the federal government, and actually was a New Brunswicker named Claudette Bradshaw, who was the Minister of Labor at the time and was also charged with the homelessness file for the federal government. And they made monies available not only to serve the homeless population and vulnerable populations, but also services to those populations. And so this particular house belonged to the Fredericton homeless shelters, and they were our first partners. And this is where we started. So at the time, we started as a primary health care facility, doing a lot of health promotion. The Faculty of Nursing had been asked to apply for this grant, and they were told that it was a great opportunity, and the partners in downtown Fredericton, who had always depended on nursing students actually for health promotion activities in the downtown, were happy to have this happen and wanted it to happen, but we had a week to apply. So within a week, there were 12 letters of support from organizations, including the Multicultural Association of Fredericton in the downtown. And we received the first grant to open our clinic. And so this was established in 2002. Another important thing that happened during that year in New Brunswick was that nurse practitioners were given the license to practice in New Brunswick. Before that time, one of the challenges that the Multicultural Association of Fredericton had in supporting newcomers, particularly refugees, was that they weren't covered by Medicare, and there was no real way to serve the unmet needs of people coming into Canada with unmet needs that needed urgent care, or I guess semi-urgent care, but certainly they needed care sooner rather than later. So with a nurse practitioner at the clinic, very early in 2003, 2004, we were able to not only provide primary care services, but also, primary healthcare services, but also primary care services immediately without refugees requiring coverage by Medicare. And that was how the solidification, if you will, of the big partnership between Multicultural Association of Fredericton and what was called at that time the UNB Community Health Clinic. So the nurse practitioner was able to meet the needs in primary care of the approximately 90 to 100 refugees that came per year at that time. We also, of course, continued with some of the other things that the federal government certainly supports, and that being the IFH assessments, or the assessments of what unmet health needs people come to Canada with, as well as, of course, immunization and other concerns that they might have in terms of being able to access the rest of the system through specialist care and so on. So I guess that the direct referral is an important feature that has continued throughout the time that we've been open now in one place or another. This was our first home. Later on, you'll hear about our forever home. And there was a little transition in between. But basically, this was the beginning of our ability to meet the needs of the refugee population in particular. And also public health became quite dependent on us for their referrals for newcomers who had public health concerns that had been identified but not resolved in the time that they came between their home country and their new home being Canada. So next slide, please. An interesting thing that happened between 2002, when the UNB Community Health Clinic first opened, and 2012 was the recognition of what needs were being met in various vulnerable populations through the UNB Community Health Clinic. The other thing that happened during that time is that we were able to solidify more allies in our work. So we always had the 12 organizations serving vulnerable populations in the downtown. They were our base of support, our community engagement. But over time, public health in particular saw the things that we were able to do in terms of health promotion with newcomer population and others. And as well, we were able to form a solid relationship with some people from Horizon Health that were in key positions. And one of those positions was the Director of Population Health, which Horizon Health Network had established in about 2010. So one of the things that person did, his name is Bruce McPherson, and he was able to do a Fredericton and surrounding area community health and well-being needs assessment leading up to 2012. He involved the former nurse manager of the UNB Community Health Clinic, Margaret Dykeman, and also another person from UNB who happened to be the Dean of Business at the time, but was also very involved in the community, the Chamber of Commerce, the Fredericton Chamber of Commerce. So we had all kinds of allies that were saying, look what this small clinic has been able to do in order to serve needs. What are the needs in the downtown? And one of the priority populations that was identified in this needs assessment was those segments of the population that are so marginalized that they're difficult to count. And so the refugee population was among those. And it was decided, or the recommendation was given, that rather than establish a CHC as in average circumstances would be done by Horizon Health or other health networks, that they would investigate a partnership so as not to lose the value of what had been happening in the downtown in terms of the community engagement that was there and the community collaboration with partners that was already established, so that a partnership would actually work better in terms of really system change. So how do we do our work? And so this was the beginning of us, I guess, is 2012, and the support that we were receiving from our allies, both in the community and in the system, if you will, public health and the primary care division of primary health in Horizon. Next slide. So the report concluded something that was really a great compliment, I guess, to us. And that's that the nursing school, the Faculty of Nursing, who were the owners of, if you will, the UNB Community Health Clinic, our living lab for students, that the students were value added. We in fact had won a Community Service Learning Award from the McConnell Foundation by this time. And so the students were actually providing a lot of value-added primary health care services in the downtown, and that our little UNB CHC was bursting at the seams, and that why not have a synergistic approach and provide something that would really be valuable and continue to be valuable to some of the vulnerable populations that they had identified, including the refugee and newcomer population. Next slide. So here was one of the overarching recommendations. And really what I see in this is that it was a recognition and support for how we did our business, if you will. And that is the outreach component. So the collaboration with community partners and going out, taking health services into the community to those who need it the most. And of course, from a systems point of view, we were really doing something valuable in terms of being able to serve the needs of those people who are responsible for some of the costs in healthcare, but also are not receiving the care that they need in order to avoid the more expensive costs in the acute care system. Most of what vulnerable populations really need is to be able to be served in a way that they are able to avoid those higher costs, the 49 to 84% of respective hospital and home care costs. With the help of collaborating community partners like Multicultural Association of Fredericton, you're able to have a win-win situation where people have their needs met in a way that is acceptable and comfortable for them. Next slide, please. Okay, and I would like to turn it over now to my colleague, Tracy Rickards.
Thanks, Joan. So thank you very much for inviting us to do this. It's really, we love to share the information and the story of our little clinic. So this is our sort of elevator pitch that we developed during a strategic planning session. And what's really important is to understand how the relationship between UNB and Horizon Health is operationalized. So there's a memorandum of understanding that lays out the terms of the partnership. UNB is responsible to hire and pay for 3 registered nurses who work in ambulatory care, and Horizon Health covers the salary costs of 3 other registered nurses. They also hire the remainder of the staff of admin assistants, LPNs, occupational therapists, RT, dietitian, social workers, nurse practitioners, and doctors. Horizon Health is responsible for the day-to-day costs of doing business. The value added benefit of the partnership is that the shared ownership allows for forward thinking, ability to pivot, and being responsive to emerging needs in the community. The values that we ascribe to were co-developed so that while we are the little clinic within the bigger clinic, we think, act, and work as one. Everyone at the FDCHC is involved in patient care, student learning, and research. Next slide, please. So this very busy slide simply demonstrates the many partnerships that we've developed that enable the work that we do. So we've partnered with government and various departments around policy decision making. We've partnered with Horizon Health Network, obviously, in which we engage in service delivery and outreach programs. We've partnered with a number of NGOs, which include the Multicultural Association of Fredericton, the Community Action Group on Homelessness, and the Capital Region Mental Health. And we've partnered with a number of other departments within academia. And I won't name them all. Next slide, please. Originally, public health, and Joan mentioned this, that public health notified us of clients entering Canada with, at the time was suspected latent TB. So we were involved with following up on those clients and ensuring that they complied with public health regulations. And then we worked with the Multicultural Association to complete those initial IFH, the Interim Federal Health Fund assessments. We also worked with MCAF to lobby government to change the policies of not providing Medicare cards to newcomers until they had been in Canada for several months, which really made a massive difference in their ability to access healthcare as they needed it. We frequently conduct immunization blitzes where we bring newcomers to the clinic and ensure that their immunizations are up to date. And many newcomers arrive without any records of their immunizations, and so we just start as if they're a brand new baby born today, and we give them what they need in order to get up to date. We use the language line, which is an interpretation phone line that assists us to communicate effectively with clients who don't speak English or French. And finally, MCAF has hosted nursing students for clinical for many years, and MCAF is a rich learning environment that the students absolutely love. Next slide, please. The UNB component of the Fredericton Downtown Community Health Center operates with the principle of social justice, caring, and primary health care. And as such, going out to where some of our clients can be found is a big part of recognizing the importance of harm reduction. The nurses and nursing students often partner with social workers, social work students, and other agencies who serve the vulnerable populations of people who are living homeless with substance issues, use issues, and in poverty. Another interesting outreach initiative involved our nurse practitioners who went to a hotel where, when the influx of Syrian refugees first began, where they were staying at a hotel, and our nurse practitioners went to the hotel to provide care to for their most pressing needs at the time of their arrival in Canada. Next slide, please. So I'm going to talk a little bit about my role as the embedded clinician researcher. And that role is to foster transformative research that will positively impact health outcomes of our clients. So I applied for and received CIHR funding as the embedded clinician researcher for a 4-year period. And this salary award has given me the time and freedom to engage in research projects that directly affect our clients. Next slide, please. So my research priorities in that role have included the effect of housing status on the health of individuals, the health outcomes and cost implications of chronic disease management by nurses, and specifically we've looked at COPD, the efficacy of outreach care for the most vulnerable and isolated individuals, and the cost effectiveness and outcomes of primary care delivery by nurse practitioners. More recently, we have received a very large grant to investigate how provision of resources for seniors can support aging in place. And we're using foot care as a tool for engagement and partnering with a plastic surgeon at St. Michael's Hospital in Toronto, using a portable camera that through infrared images of the client's feet can detect problems with blood flow before skin breakdown and ulcer development. And I've partnered with other academics to engage in research that focuses on the health of new immigrants, specifically cancer screening practices in immigrant women and youth. Next slide, please. The ultimate goal of the embedded clinician researcher is to accelerate change between research and practice and vice versa, and to decrease the time and to affect change in practice. And as well as that, to engage and spark or light a little spark of enthusiasm and excitement amongst all of the staff who may not have thought of themselves as researchers before, but who have been involved and who have participated in a lot of the research projects that we have conducted at the clinic. Next slide. I'll pass it over to my colleague, Emily Kitts.
Thanks, Tracy. As the Horizon manager for this facility, for the co-manager of this facility, I wanted to take a moment just to discuss what the value add is for Horizon, for the Health Authority to have partnered with UNB. Historically, the Horizon Health Network has excelled at health service delivery, but primarily in really traditional environments. And as a large organization has struggled to identify and really address the barriers some clients may find in accessing care, specifically around social determinants of health. And as Joan had mentioned, the community health needs assessment that was done in this area by our Department of Population Health had really highlighted that those priority populations, including newcomers, specifically refugees, and individuals experiencing homelessness or individuals who have substance use disorders, were really falling through the cracks. And the UNB Health Clinic had already really demonstrated an effective and flexible approach of engaging with these populations and providing really excellent service delivery. So in partnering with UNB, we were able to really develop a new health center that had a collaborative approach that had wraparound primary healthcare services. And we were able to leverage the existing community partnerships and priorities that UNB had already built and come alongside with the real depth of clinical staff and ability to deliver service. Thank you. I'll pass it over to Kelly.
Perfect, thank you, Emily. So I'm just going to take a moment to speak about some of the initiatives in place to support the future of the FDCHC partnerships. And so in July, a new position was created, and that's the position I'm currently in, which is the Director of Community Research Scholarship and Teaching. And my first task was really to work closely with the Director of Experiential Learning at the university to create what we called an opportunities mapping exercise, where we actually had students interview our community partners, our not-for-profits, and other agencies affiliated with the Community Health Center to inquire about opportunities for students from all faculties and departments to be more involved in community through experiential learning opportunities. So we wanted to take what was already in place in terms of a living lab for nursing students and really expand this concept of living lab to all faculties and departments within the university. And we saw a huge opportunity there. And one of the partners was the Multicultural Association of Fredericton, who identified a number of unique projects for students to collaborate on. And they identified potential projects within the faculties or the departments of psychology, education, kinesiology, business, nursing, and Renaissance College. So you can start to see the breadth of which which the university students could participate in experiential learning opportunities. And so we're now in the process of seeking funding for a project coordinator for community experiential learning opportunities, and working with faculties to discuss how we operationalize these opportunities within the community settings. And we've certainly heard from many, many community partners the excitement about these new opportunities with students to engage with their agencies and associations. Also, part of my role is to support community-based research and build upon the work that Tracy has done in her embedded clinician role. And so in the next couple months, I'll be turning my attention to working to form more partnerships between community partners and university researchers to meet common goals and objectives. And just as quick examples, and what I have up on the screen here, just two examples to highlight is I'm working with Tracy to integrate a health and safety app for women who are experiencing intimate partner violence into the nurses' toolkit within the community health center. And that came directly from identified needs of the nurses to want to better support women and survivors of intimate partner violence. And so this is an evidence-informed app that nurses can use in their everyday practice with individuals experiencing intimate partner violence. As well as we're working towards having all nurses within the community health center certified as iHeal nurses. And iHeal is evidence-informed community-based health promotion intervention that is delivered by nurses to women who are experiencing intimate partner violence. And I'm a principal investigator on this study. And so these are just a couple of examples to what Tracy was speaking about the timely and rapid infusion of evidence-based practice into the community health center, and that translation of research into practice quite quickly with low barriers. And so I'm looking forward to many future collaborations with the staff of the Community Health Center and community partners as we look towards the future and research, scholarship, and learning opportunities into the future. And so I'll hand it back to Joan.
Thank you, Kelly. So I'd just like to, on behalf of all of us, sort of wrap up what we've been doing here for the last, I guess, over a decade now. And I think my colleagues have done a really good job of showing where we can go still, because we're always evolving. We're always looking at what are the needs of the community at this moment, and how can we help to address those needs and those gaps. So in front of you, you'll see our Forever Home. It was a nightclub at one time. It ended up being a perfect space because its location is very accessible in the downtown of Fredericton, and quite close actually to the Multicultural Association of Fredericton. What you'll see in front of it is a COVID testing tent, and we have provided that service during these difficult times. And one of the reasons that we need to be able to continue that particular service is because some people, like those who have not got good skills as of yet in either English or French, feel far more comfortable coming to a place like the Fredericton Downtown Community Health Center to receive all sorts of care, including COVID testing. And when you think about the language line, and I don't know if all of you have that service in your province, but because Horizon does provide that service, we are able to communicate far more successfully with people even who have just come with no ability to speak either English or French. And we are, and I'm very proud of this, we are the largest or the most common user of the language line in all of Horizon Health, even though we're a very small piece of the care providers. And so it really is because of our mandate. We wish to serve, and we do everything we can to use all of the tools at our disposal to serve people in a way that addresses the social determinants of health. And of course, for newcomer population, especially refugees who come with very limited language skills, it's really important that we're able to communicate with them and build trust. And building trust for all of our different vulnerable populations is probably job number one for us. So anyway, thank you very much for having us here. Again, thank you to Liliana and the Multicultural Association of Fredericton for kind of promoting us and the partnership that we have and the value that we add to services in Fredericton. And so I guess I'll turn it back over to, I'm not sure who, maybe Mariah.
Thank you, Joan. I'll take it from here. And I just want to acknowledge a couple of comments in the question and answer box. So Doa said our amazing director, Liliana, and that was at the beginning of the webinar in reference, Joan, when you were mentioning your strong partnership with the Multicultural Association of Fredericton. And another comment here from Christine. She says, not a question, but more of a comment that this is such a great innovation to leverage the great strengths of nurses to the overall health of our population, but especially to newcomers. Congratulations. And so I'll move to our first question, and I'll turn everyone's attention to the Q&A. I'm just starting at the top, and this is open to all of our speakers. And the question is from Christine, and she's asking, what would you suggest as the first step if another town wanted to duplicate this endeavor between a faculty of nursing and the settlement sector when approaching health funders?
It's Joan. I would say building your community partnerships and leveraging those partnerships in order to have allies, because for government, they have to recognize that there's a need before they're willing to address that need. So I think that building the community partnerships, all that work that was done even prior to 2002 by the Faculty of Nursing, actually led to the recognition of the need. And then of course the needs assessment by Horizon Health in 2012 really solidified that and had it be sort of formalized, I guess, that actually these needs had been being met, that rather than try to build something new, why not take a new approach that had proven itself to be reactive and able to fulfill needs in a sort of a less formal fashion, I guess, if you want to say it that way. Small organizations are, with the right set of values, are able to move things far quicker than very large organizations, that being either a university itself or a health network, for instance. So we're kind of the sweet spot, if you will, of a collaboration that is able to fulfill needs and pivot very quickly. But community partnerships and community support, I think, is really important in terms of starting to be able to convince funders that a place like this is the right way to go, the best way to go.
Thank you, Joan. And our next question is from Zing, and this is addressed to Tracy. And the question is, could you explain more about how the interpretation phone line works to help newcomers who do not speak English or French? Thank you.
Oh, I'd be glad to answer that question. And I'll do it through an example. Yesterday afternoon, I had two nursing students who conducted an IFH assessment on a family of a mother and father and their 6 children. And so they were from, had been in Canada for a little over a year and were from Syria originally and spoke Arabic. And none of us speak Arabic. And so we pick up the phone and we dial a number and we put in our identification code. And then they ask us, what language would you like? And we say, we'd like Arabic, please. And somebody comes on the line who is Arabic speaking. And at that point, the nursing students are able to ask the interpretation line to ask the clients all of the questions that they're looking to answer. So for instance, do you have any previous health concerns? And so then the interpreter asks the client that, and the client provides an answer that the interpreter then translates or interprets and gives back to the nursing students in English. So it's a little bulky, the back and forth, but it works so much better than charades and any other form of, trying to find an interpreter and having an interpreter come which can also be challenging to have another person from outside of their family to hear all of the personal information that they provide. So this works really well.
And just in follow-up to that, Tracy, who pays for the service? Who is eligible to use it? Is it available for primary care physicians, for instance?
Well, it's Horizon Health that pays for it. And as Joan mentioned, we're the biggest users of it in the sort of Horizon Health network, which is kind of fun because we're not the biggest department, let's just say. But we make very good use of it. I'm sure that it is available at a cost to other people, but yeah.
Great, thank you. And our next question is, was your advocacy to have provincial health coverage and not IFH, so that's the interim federal health program, successful? Do they get provincial coverage right away, or is it a reduced wait?
Okay, so that's mine as well. So yes, they now get health coverage from the province as soon as they land. They're all given a Medicare card upon arriving in New Brunswick, which has, as I mentioned earlier, has really made it much simpler. Frequently, people who are coming as refugees have spent a large amount of time in refugee camps where access to healthcare has been minimal, if any. And so we, often have people who are arriving who are diabetic, for instance, and haven't got any medication. We had a family just recently arrive whose little boy had been diagnosed with leukemia and had undergone one round of treatment, but needed to be followed by somebody else. And so we were able to immediately get him connected with a pediatrician and oncology services.
Thank you, Tracy. And our next question is open to all of the speakers. How has the COVID-19 pandemic impacted the services provided by Fredericton Downtown Community Health Center and clients?
Maybe I'll answer this one. I'd say the last 2 weeks in March, when everything was when I think all of us in Canada were sort of taking a breath, figuring out, so what's our new normal now? We definitely had a 2 or 3 week period where there was an interruption to service. Many of our nurses and LPNs and our respiratory therapists were pulled from their regular duties and assigned to that COVID testing tent that Joan had put up on her slide. And then by about a month in, a lot of our regular services were reinstated, that we might do it a little differently. There's more opportunity if someone has the ability to do a virtual appointment. They can see their primary healthcare provider or some of the therapeutic services either over the phone or like in a Zoom meeting. But we've just kind of reworked how we do appointments, and we've increased cleaning, and we're a little more creative about scheduling so our waiting room isn't too full, so that we can accommodate physical distancing and social distancing. And yeah, so all of our services are back up and running, but there was a slowdown for about the first month while we all sort of figured out what the processes were. Yeah, but it certainly has been different. You go ahead, Joan.
I just wanted to add something, and that has to do again with the language line. The other great thing about the language line is that you can actually do a 3-way call. So if a nurse practitioner or physician wants to speak to the family that's home for whatever reason, the reasons that Emily was speaking of, or others, like we have actually helped families who were required to self-isolate just recently, then the 3-way communication with the language line. So the language line actually calls the family and us, and we're able to communicate in that way. So just so you understand how flexible the language line really can be.
Thanks, Joan and Emily. And Patria just wants to say that this work is extraordinary, wow, very inspirational, and helps inform future opportunities for researchers and community partners. Thank you. And we have another question here from Natalie. And she said, I was very interested to learn how you were supporting an experiential learning program. I have developed similar programs and would be happy to connect. So we will make sure to get Natalie and put Natalie in touch with you. And another question, this is addressed to Joan. And Lorna is asking, would you speak to the opportunity for nursing students to learn policy and action as you interact with City Council in Fredericton? How does the city work with you?
Those are kind of acquired skills, I guess. I spent some time in government, both elected and supporting elected people. And so I have a lot of connections in the community and I'm relatively well known. So I kind of know how the system works. There's a lot of things in the system that are unwritten. And in order to negotiate through, you have to know someone who knows someone who knows someone very often. And so that's how I work. But I love to do policy development. It's primordial primary health care, which is great. And often the primordial part starts with having the decision makers understand how important it is to address certain issues. So I've been lucky enough to be able to take students to City Hall while I was advocating for one thing and another, including another cold shelter. I was able to take students to the Canadian Federation of Nurses Unions to talk to 900 nurses. That was really exciting, about the importance of voting and kind of how to lobby. So anyway, it's another part of nursing, but advocacy is very, very exciting to me, and it's sort of how I got back into nursing from public life, because I figured out when I was there that by learning to be an effective advocate and learning how the system works can also help with other things, like the development of something like what we have in Fredericton at the Fredericton Downtown Community Health Center. But I could never have done it alone. I needed all the partners, all the people. Nobody can ever do anything alone, and everybody has a certain skill to offer. So connecting and networking and advocating is a really important piece of making certain changes, systemic changes.
Thank you very much, Joan. And that is, oh, and just a question here. It's from Sahar, and she commented, great presentation. Do you think N4 could help with the advocacy? I'm seeing some head nods from Joan and Emily.
I guess that's how I started out, by thanking Liliana and the Multicultural Association of Fredericton, because they have understood over many years now what that partnership is able to achieve over and above. We have lots of things we'd still like to do together. And I think that the sky is the limit, but working together, lending whatever you lend to any partnership is really important. Collaboration is a really exciting and fulfilling work. And I think that we sort of need to get out of our silos a little bit and think about how to work together. And always think about how to work together, because if we don't do that, then we tend to stay in our own lane, and sometimes that's not the best for the population as a whole, or the populations that we're trying to serve.
Thanks, Joan. And the questions just keep coming in. Sue has said, great presentation. The synergies between teaching, research, and practice are really exciting. The potential for uptake or research findings is especially important. The interdisciplinary practice setting also presents unique opportunities. How are/can members of the community you serve be included in identifying research priorities? And that is open to all the speakers.
That would likely be me. And so thank you, Sue, for that question. And, you know, there's multiple paths that we are taking. We're building upon the research that has already been done, led by Tracy and others in terms of the embedded nurse clinician. We're also working in community partnerships. So we are hearing from our community partners what their most pressing issues are, what their needs are, and it really is from the ground up based research. And then part of my new role is really reaching deep into the university and trying to look for those extended partnerships with the university in terms of researchers wanting to help conduct community-based research with community members. And so it's very, as I said, very much from the ground up, and we're now on the path of establishing those types of exciting partnerships to conduct even more research out of our little CHC. So it's exciting times.
Thanks, Kimberly. And there's a question here from Kimberly. If you could provide one tool other than translation that has helped you work with newcomers, what would it be?
I think the tool is not the tool, it's the partnership. It's the back and forth that happens between like us, the FDCHC, and the Multicultural Association of Fredericton. For instance, just the other day, there's someone in the community. The person is a fairly newcomer, just past a year. The person has some real challenges with mental health and has become homeless as a result, and has also had some brushes with the law. And so the person who I haven't mentioned yet, but his name is Abdelhamid Aldousuki, and he is he's a surgeon in Egypt, but he's been in Canada for quite some time now, and he works with addressing the health needs of newcomers and not so newcomers, people who are still connected with the Multicultural Association of Fredericton. So we were able to get a Zoom call together to see how we can, at the FDCHC, use our outreach services, how Multicultural can help, because they have, Abdelhamid himself, as well as one of the other workers, has a trusting relationship with this person. And the probation officer was there, also very much wishing to gain enough trust with the person to be able to have him accept the help that we could provide. You know, hooking together with mental health for a mental health assessment and intake, being able to have him be on a housing list, have him be able to use the address of 339 King Street, which is a whole other story, to be able to receive social assistance now that he's not supported by the federal government because he's been here over a year. So anyway, it's that kind of thing. If Abdelhamid was not comfortable coming to us with such a thing, we probably, because it was quite complicated, but because of the long-standing relationship that we have, and because it's so multifaceted, Emily has a relationship, Tracy has a relationship, you know, we have a relationship with Liliana and Abdelhamid and half a dozen others that is ongoing, and that's a really important tool, if you will, of us being able to serve the various needs that people have.
Thank you very much, Joan. And as you were saying at the beginning, your colleagues were all nodding in agreement with what you were saying. And so that brings us to the end of our presentation and the question and answers today. And I just want to thank our speakers very much for taking time out of your day to tell us the story of the Fredericton Downtown Community Health Center. This is truly a really innovative, embedded community partnership. And I also want to thank all of you who have attended for taking the time to join us. And we hope that you will join us for upcoming webinars. Thank you for your questions and your engagement. Following today's session, you will be invited to complete a survey to share your feedback with N4. These surveys help us to continuously improve and seek out new webinar content and opportunities that are responsive to topics that you're interested in. So we kindly ask that after the webinar, you take a moment to complete this brief survey. And if you missed any part of today's presentation or would like to watch the session again, we will be posting the recording on the N4 platform within 24 to 48 hours. And our panelists will also be posting responses to any unanswered questions today in our platform's feature, The Meeting Place. They'll also answer any additional questions you may have related to the webinar that you didn't get a chance to ask today for up to 10 days following the webinar in the Meeting Place. If you are not currently a member of N4, we invite you to become a member. There's no cost to join, and my colleague will put a link in the chat box to the newcomer navigation website. And thank you again, everyone. We hope to see you again at a future N4 webinar. Stay safe and be well.